Dave, the State Department of Community Health has confirmed tonight that there are 3 cases of the enterovirus D-68 here in Michigan. It's a respiratory illness that has so far been primarily affecting children. 7 Action News reporter Tara Edwards joins us now live with more. Tara?
Well, Malcolm, the enterovirus is something that doctors typically see around this time of year, but this particular strain is something that parents should look out for. It's a nasty virus that has already attacked at least 3 patients here in Michigan. According to doctors, the enterovirus is nothing new, but they haven't seen a bug with such a bite in years.
This particular enterovirus seems to be one that's causing a lot of distress, and it's doing so in the lungs, especially of smaller children.
The enterovirus is an illness that Dr. Steve McGraw, chairman of emergency medicine at Providence Hospital, says typically strikes from July all the way into fall. Children are more exposed to it now because they're back in school.
Entero is just it means it involves the inside lining of tissues, so the inside of the GI tract, the respiratory tract. Those are all parts of our body that communicate with the outside world. This is a virus that seems to be especially effective in attacking those areas. That whole family of viruses is like that.
With this particular strain, D-68, kids can have mild symptoms. The typical cough, runny nose, low-grade fever, and body aches.
But there are people, for reasons that aren't really clear yet, that react more violently to it, and they become very wheezy, very difficult to catch their breath.
It's been a while since a bug like enterovirus D-68 has caused a number of patients to be admitted to ICU. And while patients who are asthmatic may have a greater chance of catching it, Dr. McGraw says if your child has these symptoms, don't delay a trip to the hospital.
They'll breathe very rapidly, sometimes 50, 60 times a minute, and they look out of breath. Their abdominal muscles start assisting their chest to breathe, so you see their abdomen going in and out. You see the area above their sternal notch where they begin to sort of tug the air in. They're working so hard to breathe. Those are all signs that the child's really having a hard time.
And we're told that this virus is just as contagious as any other virus. You can catch it just from being around infected people. And again, doctors are reminding parents to make sure their kids are washing their hands often. Live at Providence Hospital, Tara Edwards, 7 Action News.
Thanks, Tara. And